And then how do you monitor like type 2 diabetes, the progression of it?
Yeah. So when we see, before I go and monitor of type 2 diabetes, one aspect which I have seen in many patients coming to my clinic is they come to my clinic but they don't take their shoes. And in a diabetic examination, without checking the feet, it's not a complete examination. A lot of people don't even realize it. The one reason I want to emphasize the feet examination specifically is, one, when we examine the feet, we check for the pulses to see how the blood supply to the feet is. That
Right.
gives a good idea. If they have a circulation problem, the risk of heart problem is very high.
Sure.
We also check for the sensation. Because diabetes is a silent disease, by the time we diagnose diabetes, they might have had a damage to the sensation and nerves are damaged. They can get ulcers in the feet.
Yeah.
And we also educate about how to take care of the feet. This is a common thing. A lot of people go to nail shops and they get a clean cut nails.
Right.
But that's not the best way to do it. If you cut your nails very perfect, you tend to get ingrowing nails, so
Yeah.
that is a problem.
Yeah.
So I generally educate my patients about foot care, and that's a very important part. Once they have a foot problem, they won't do exercise.
Right.
They will postpone it. They have a reason, and that is a genuine reason.
Sure.
So we start with that. Now, coming back to monitoring, first we established, once they're diagnosed, I tell, if it is in the first 2 years of diagnosis, it's a golden period. If you do manage very well, you are preventing many of the complications.
Yeah.
The way I tell my patients is hemoglobin A1C once in 3 months.
Yeah.
I strongly recommend it.
Okay.
Urine microalbumin, blood pressure, making sure cholesterol is in a good range.
Yeah.
And
Okay.
these are the things which I look for.
Okay.
And also baseline kidney function test, we do that all the time.
Okay. Good. And then, we talked about oral medicines. Do type 2 diabetics ever require insulin?